I still want to get your thoughts on what you believe will be the greatest advance in healthcare to improve the overall quality of life.
Michael, I was thinking about that because you said you were going to ask that question. And I think it depends on the silos you're thinking about. So if I were looking at this group, I remember the first radical prostate, when I was a resident at Northwestern, and we had to do a radical prostate. All I knew is it was going to be 12 to 14 hours with losing liters and liters and liters of blood. And then I remember as an attending being the anesthesiologist for the first robotic prostatectomy at Beaumont, done by MIU physician and your partner, Jim Relly. And I was the anesthesiologist there too. And I remember then, because it was the first one taking, 12, 13, 14 hours with the patient almost on their head. And now knowing that we do prostatectomies with a robot in, an hour and a half, 2 hours, 2.5 hours without a drop of blood. It's just amazing when you see the things that we've gone through, or procedures with certain biopsies that we'd have to put patients to sleep for that now can be done in the office. If you ask a cardiologist, what are some of the greatest advances? I'm sure he or she would say statins, or they'd say stents, or they'd see, fixing valves through the groin. I think it all depends. The things that you couldn't have imagined years ago. Think of what colonoscopy. We can catch colon cancer early. So if you think of the things we do with laparoscopes, with robots, with various scopes that just didn't exist just a few years ago, that's able to actually give it better care for patients. So the answer was wide open. It could be very broad. As a proceduralist, I see it as this is the things we do in operating rooms today that have totally changed, or the things we don't do anymore. The vascular procedures that are done in radiology suites that used to involve major procedures, AAAs, abdominal aortic aneurysms, that used to have a 6-hour procedure, lose tons of blood, that would go from an incision that would go from your chest all the way down to your umbilicus. We don't do that anymore. We go in there, we just give them some sedation. They put a stent in, or they put a graft in. I mean, it's amazing just the things procedurally that I've seen in my career just in the past 10 to 15 years. So it was a loaded question, but I gave you lots of answers.
It was loaded, and you loaded it up, and I appreciate it. And I just wanted to say thank you to both of you, to Doctors Gordon and Grant, for making tonight such a special night to talk about things that were more than just prostate cancer, things that mean something to each and every individual, not only here in the United States, but across the globe, who've actually endured the last year of the pandemic and are looking forward to being pandemic free. And the future of vaccinations and the future of prostate cancer management, just to top it off. Without your expertise and resources, we wouldn't be able to have had this conversation tonight with all the people who are watching and part of our prostate cancer survivorship community.